Hello everyone, welcome back to my channel. So today we will be learning about Aphorism 1 to 8 in Organon of Medicine. First, before that, let's learn what is organon. The term organon refers to a tool or instrument of thought used historically to describe a set of principles, philosophy, and methodology for the application of homeopathic medicine. So, our master Hahnemann has thought to convey us about the homeopathic principle. Hence, he thought to write a book that's called as Organ of Medicine, and in that book, he has written each and every important points in a method of aphorism. What is aphorism? That I will be saying later. So first, in that book, it is called as organon. So organon refers to a tool or instrument of thought. So what all he has thought, or what all he has discovered has been put in this book. So it lays out fundamental concepts like the law of similars and the pretendization of substance to treat disease. So now what is aphorism? Hahnemann has used a peculiar aphorism method to convey to us. So what is an aphorism? An aphorism is a concise and often witty statement that expresses a general truth or observation about life. In short, it is a memorable phrase conveying wisdom of a piece of advice. So aphorism means it's a paragraph, isn't it? In each paragraph, he's conveying to us something important or a wisdom, a piece of advice. So that is called as aphorism. So in this, we are going to learn from aphorism 1 to aphorism 8. So aphorisms in the organ of medicine are concise conclusion derived from Hahnemann's experiments on healthy individuals and patients. It guides homeopathic practice, explaining various treatment modes and 7 cardinal principles. These aphorisms essentially convey Hahnemann's experiences and interpretations, offering essential insights for successful homeopathic application. So first aphorism is the most important. You should by heart this. You should by heart aphorism 1, aphorism 2, then 9, 26, etc. So first one is aphorism 1. The physician's high and only mission is to restore the sick to health, to cure, as it is termed. So what is the explanation of that aphorism? The primary and the most important duty of a physician is to heal the sick and cure illness, aligning with the principles of homeopathic medicine. So we must obey the principles of homeopathic medicine, plus we should cure the patient. That's the main important duty for a physician. So in footnote of aphorism 1, it is said that when you're going through this, when you are seeing this video, please don't forget to take your organon textbook and keep it aside with you, so that if you have any doubt, you can check your book and it will be easy for you. You can take notes, etc. So its mission is not, however, to construct so-called systems, but interviewing empty speculations and hypotheses concerning the internal essential nature of the vital processes and the mode in which disease originate. So in Hahnemann is stating that the physician's mission is not to develop theoretical frameworks or systems based on speculative ideas about how disease originates within the body. So in whereon so many physicians have hitherto ambitiously wasted their talents and their time. So in here he criticizes the fact that many physicians have spent their skill and time and ambitiously pursuing these theoretical ideas. So before if I am reading this and giving the explanation, it will be boring for you. So for that, I'm first you just pause this video. Now read through the aphorism. Now after that, you read the footnote of aphorism 1, and after that you on this video. So I'm going to explain what is footnote of aphorism 1. So in the footnote of aphorism 1, it deals about theoretical medicine. So Hahnemann is stating that physician's mission is not just to develop theoretical frameworks, not just develop ideas or any why the disease is coming, what are the pathology. The physician is not to make some stories or anything concerning about disease. Instead, and thereby he is criticizing such physicians that they have spent their skill, time ambitiously just making ideas. He's not promoting just to make ideas or to just don't think about disease. Instead, he is telling to practice by, instead of wasting time by explaining disease phenomena to the patient, we must use our skill to impress the patients by giving the right remedy. We should find the totality of the symptoms of a patient and thereby find the simillimum, that is the remedy of that individual. So he suggests that some physicians use complex language to impress those who are not knowledgeable about medicine. For example, a simple person, a layman person comes to the clinic and you're just explaining the process of potentization is like so and so, otherwise a disease, for example, pathological of the cancer, it's due to such leukocytes. Such words will not be understood by such common man. So instead of that, instead of wasting time, just see the patient, know the course, write the medicine, give them suggestions. That's enough. Why to waste time? That's what he is saying in this footnote. Despite these theoretical pursuits, sick people continue to suffer without receiving effective assistance. So if we are saying this, we are just wasting our energy. We are just wasting time of ours. We are just wasting the time of the patient. So instead of that, the sick will always be sick, even if we say some theories. So Hahnemann declares that society has had its fill to these theoretical musicians, which are often referred to a theoretic medicine and are even taught in academic settings. So he concludes by urging physicians to stop deceiving patients with empty words and instead take action to genuinely help and cure them, emphasizing the importance of practical application in medicine over the theoretical speculation. So when you write aphorism and a footnote of aphorism 1, first you should give a heading of theoretical medicine and you should say before the physicians, like old school medicine, that is allopathic medicine, that's what he meant. Just instead of making theories or instead of making some disease conditions, pathological conditions, and instead of wasting time, he is suggesting us to find the remedy by observing the patient and knowing the condition or the suffering of the patient. So that's all. Now aphorism number 2. This also you should by heart it. The highest ideal of cure is rapid, gentle and permanent restoration of the health, or removal and annihilation of the disease in its whole extent, in the shortest, most reliable and most harmless way, on easily comprehensible principle. On easily comprehensible principle means understanding principles such as law of simplex, law of similia and law of minimum dose. So the explanation is Hahnemann outlines the highest ideal of cure in medicine according to his principles. Now let's dive deeper into its meaning. So now just pause the moment and now read the aphorism by yourself. And after that, hear the explanation. So the highest ideal of cure is rapid, gentle and permanent restoration of health. Hahnemann sets the standard for an ideal cure, that it should be rapid, meaning it should be acting swiftly, so fast. It should be gentle, implying that it should not cause any harm or discomfort, and it should be permanent, that restoration of health should be long lasting and enduring. And along with this, the ideal cure should completely remove or eradicate the disease from the body, and there should be not even a single trace of the disease. So Hahnemann emphasizes that ideal cure should achieve its desired outcome quickly, with reliability and without causing any harm. So on easily comprehensible principle, so it means that the patient should, when you give the medicine, it should be based on the principles. So overall, Hahnemann's statement encapsulates his vision of the ideal approach to healing, which prioritizes effectiveness, safety and comprehensibility in restoring health and eliminating disease. It reflects his commitment to provide patients with the best possible care while minimizing any potential risk or discomfort associated with treatment. Now comes aphorism number 3. Pause the video, read by yourself and understand it. After that, on the video. So in aphorism 3, you should write the heading as knowledge of a physician. Knowledge of a physician, or it's also called as true practitioner of healing art. True practitioner of healing art. So in this, it deals about the physician's understanding or knowledge of a physician. What all knowledge should he have? Knowledge of the disease, knowledge of medicinal power, choice of the remedy. Here, choice of the remedy, the medicine indicated, dose, proper dose, then obstacles to recovery, So all these points must be noted. In aphorism 3, what a knowledge a physician should have. A physician should have a knowledge of a disease, should have the knowledge of medicinal power by drug proving, should know the remedy, how it is indicated, should know the dose, potency, repetition, should know obstacles to cover. So this is aphorism number 3. Now aphorism number 4. It deals about preserver of health. He is likewise a preserver of health if he knows the things that derange health and cause disease and how to remove them from persons in health. So it means in the statement, Hahnemann explains the role of the physician beyond just treating disease to also include preserving health. Now let's deep meaning. So Hahnemann is suggesting the physician to be a preserver of health by understanding factors that disrupt or impair health and contribute to the onset of disease. So he is telling about lifestyle factors or environmental influence or what is the cause of the disease. We should learn first that. Then how to remove them from persons in health. So after knowing them only we will be able to identify them. So if we identify them only we will be able to eliminate them. So if we eliminate them only the patient will have a good state of health. So for that we should give guidance to the patients by suggesting them healthy habits, recommending preventive measures and advising on environmental modification to promote well-being. So he's telling to become a preserver of health, giving them ideas. In this ideas I am telling you that is necessity, not just about disease condition idea, instead about lifestyle changes, about the cause of the disease, that is maintaining that cause. For example, the person is having allergic to perfumes and all. So if the person is still on using that perfumes or cosmetic things, then he will not be getting cure. So we are giving them an idea about that. So please don't use that perfume because this is the reason you're having this disease. So it's advised you to take off that habit. So that kind of ideas, not the previous ideas which I have told before in aphorism 1. So overall, Hahnemann emphasizes that a true healer not only treats illness but also actively works to prevent disease and promote overall health and well-being. By understanding the factors that can disrupt health and knowing how to address them, the physician plays a crucial role in preserving and maintaining the health of individuals and communities. Now, aphorism number 5. It is the exciting cause, the fundamental cause set in this aphorism. So now pause the video, read by yourself, then on the video. So in aphorism number 5, in this passage, Hahnemann emphasizes the importance of understanding the underlying cause of both acute and chronic disease to effectively treat patients. Now let's break down the meaning. So Hahnemann suggests that knowing the likely trigger or cause of an acute illness can be helpful for the physician in devising an appropriate treatment plan. This could include factors such as recent exposure to pathogens, environmental influences, or events that precede the onset of disease. So if a patient is having an acute disease, disease means a short interval time a disease has occurred. Chronic disease means in a long interval the disease has occurred. So an acute disease is caused due to some trigger or some pathogen, environmental influence, or some other specific reasons. So for that, the Hahnemann is giving some idea about it. Then in chronic disease, Hahnemann is saying about the importance of understanding the entire history of the illness, including the significant events, patterns of symptoms, and past treatments. So when you treat a chronic disease, you should learn about the history of the illness, the significant events, pattern of the symptoms, and the past treatments he has taken. So we should know whether he took some other modes of treatment, like some other system of treatment like allopathy, ayurveda. So we should understand all such things. By analyzing this comprehensive history, the physician can uncover the fundamental cause of the chronic condition, which Hahnemann often attributed to a chronic miasm or underlying predisposition. So all these, Hahnemann has underscores the need for a thorough assessment of the patient's overall constitution and lifestyle factors. So we should learn the constitution and lifestyle factors. So when we learn that, what all we should not? We should learn about physical characteristics, personality traits, occupation, living condition, social interactions, age, sexual health. By taking into account all these factors will help us to gain holistic understanding of the patient's health, and that we will be able to give great treatment to them. So overall, Hahnemann highlights the importance of a comprehensive approach to medical diagnosis and treatment. So first, we should learn what is acute disease, what is chronic disease, what all things we should understand and ask them when you are taking acute disease, what all things you should take a look on chronic diseases, what all you should tell about physical constitution of the patient, or about the moral and intellectual character, or about his occupation, mode of living, habits. All these things must be noted. So when you go through aphorism 5, you should highlight exciting cause of the acute disease, highlight the fundamental cause of fundamental cause is the miasmatic cause, that is chronic disease. Okay, exciting cause leads to acute disease, fundamental cause leads to chronic miasm, that is chronic disease. So then you should underline physical constitution of the patient, moral, intellectual character, occupation, mode of living, etc. etc. So that's all about aphorism 5. Now it is aphorism 6. So when you go through, if you're not understanding it, please comment below, and I will be in which area you didn't understand, I will be giving a separate topic on that. So please comment below if you have any suggestions or any doubt. So in aphorism 6, it tells about portrait of the disease or unprejudiced observer. So this so now take a while, just read through your topic and I will be explaining it. So in this aphorism 6, Hahnemann tells us a physician should be an unprejudiced observer. So the physician should not be a bias, he must be an unbiased observer. By seeing some symptoms, for example, the patient is having changeability, the patient weeps easily. So by thinking this, we will think of pulsatilla remedy. We will think, okay, those two symptoms, okay, let us give pulsatilla. That is prejudication. We should not prejudice. We should not think that is the remedy. Instead, we should, that may or may not be a remedy to that patient. So we must keep on asking the questions related to the disease, and we should finally, at last only, we should conclude which remedy we should give. We should not prejudice the remedy. So that's all. That's what he tells in this aphorism. He suggests that even if the observer possesses exceptional insight, they should focus only on observable changes in both physical and mental health when examining each disease. So this part elaborates on the types of observable signs and symptoms, that is morbid phenomena, accident, symptoms. All this should be kept in attention through senses and all by means of senses, touch, smell, all such things will be observed. Sometimes the patient will be having foul smell when they talk or when they are sitting aside us. So that's all must be noted. Okay, the final sentence underscores the significance of collectively considering all observable signs and symptoms. So first we should understand the full portrait of the disease. That's what, and we should not be prejudicing. We must be an unprejudiced observer. So portrait of the disease and unprejudiced observer is the main topic set. It is said in aphorism number 6. And in footnote of aphorism number 6, prima causa morbi is said. Primary cause of the disease. Prima causa morbi is the primary cause of the disease. Causa occasionalis is the exciting of maintaining cause. So aphorism number 7. So in aphorism number 7, the totality of symptom is said. Exciting or maintaining cause, that is causa occasionalis. Then miasm, then accessory circumstances. All these things are discussed in this. Now take a moment, read by yourself and on the video. So this sets the context for disease where there is no obvious external cause that needs to be addressed. So in such cases, observable accepts are the abnormal symptoms or manifestations of the disease, isn't it? Observe, when we are able to observe the symptoms, we know that abnormal symptoms are the manifestation of the disease. Manifestations are the result of the disease. So understanding the underlying cause is not evident. The symptom themselves acts as a clue. So symptom is the clue of indicating us what treatment we should give. So it highlights the importance of considering the entirety of the symptoms, which reflect the internal nature of the body. So through signs and symptoms only we will be able to understand what is happening inside our body. So we cannot see inside our body, isn't it? Only through X-ray only we will be able to see the bones. Likewise, so many things happening inside our body. So how we will understand that? So through signs and symptoms, through observable signs and symptoms, we will be able to conclude what kind of disease is having. So through signs and symptoms, we will be understanding the portrait of the disease, and by understanding the portrait of the disease, we will be able to understand the totality of the symptoms. By taking the totality of the symptom, we will be able to give the right remedy, that is called as similima. So by understanding the primary or the secondary or whatever cause of the disease, we'll be able to give a suitable treatment. So by diagnosing the disease and treating the illness, we'll be able to select the right remedy, and that right remedy will be holistic nature and thereby will give us correct cure of the patient. So the footnote of aphorism 7 deals with indisposition, and in footnote and in aphorism 150 also indisposition is said. Okay, now aphorism 8. It is not conceivable, nor can it be proved by any experience in the world, that after the removal of all the symptoms of the disease and of the entire collection of the perceptible phenomena, there should or could remain anything else besides health, or that the morbid alteration in the interior could remain uneradicated. So in this passage we will learn about that the real it refers to complete elimination of all symptoms and observable manifestation associated with the disease. So all symptoms of a disease has been addressed. A removal of all the symptoms of the disease and of entire collection of the perceptual phenomena means there should be nothing left. If you remove all the symptoms, it means that there is no disease. That's what is said in this aphorism. Removal of the symptoms or removal of signs and symptoms means removal of the disease. That's said in this aphorism. It means if there is no symptoms or there are absence of symptoms, it means absence of disease. So these are the aphorisms from aphorism 1 to 8 I have taught, and in aphorism 9 it deals about definition of vital force, and in aphorism 10 it is vital force in it. So in this is the just one word remembrance of this tips to remember. Aphorism 1 to 10. Aphorism 1 deals with physician's mission, 2 ideal cure, 3 knowledge of physician, 4 preserver of health, 5 causes anxiety maintaining fundamental, 6 unprejudiced observer, 7 removal of totality of symptoms means removal of disease cause occasionalis, 8 restoration of the health by removing the symptoms. That's what. 9 is definition of vital force, that should be by hearted, and 10 this vital force in death. 10th is death. So that's all. Thanks for listening. If you have any questions, please comment below, and don't forget to like, share and subscribe. And that's all. Thank you.